Hi, my name is Kayla Wolf. This is NBC 354, Patient and Family Centered Care Change Project. My change project was on implementing bedside report. I have included the honor code at the bottom of this PowerPoint. I have read and understand the course objectives, course requirements, methods of evaluation and grading and policies, including the SON honor code. I agree to adhere to the course guidelines for academic integrity and professional behavior. The overall aim of my change project of implementing bedside report was to increase patient satisfaction and safety, to improve communication between nurses during handoff, and to increase nursing satisfaction. Evidence from literature. I was able to find an article known as Improving Client and Nurse Satisfaction Through the Utilization of Bedside Report in the Journal for Nurses in Professional Development. It states, bedside report increases client safety and satisfaction, creates trust between the nurses and the clients, reduces communication errors, and promotes accountability, teamwork, and respect among staff. Another article I found, known as Hardwiring Bedside Shift Report in the Journal of Nursing Administration, states patients who experienced bedside report stated feeling safer. Safety scans are opportunities to review the environment for safety concerns or prevention measures and are performed by the care provider. Safety scans during bedside report in the literature include medication review, call light in reach, in reviewing suction, oxygen, and other equipment regarding proper settings and performance. Researchers have reported incidents such as medication errors, falls, skin cares decreased after bedside report implementation. The third article I found, known as Can We Talk? The Bedside Report Project, states medication errors related to handoff communication decreased 80% from 5 to 1, and the patient falls related to handoff communication decreased 100% from 2 to 0 after implementation of the BSR bedside report system. The surveys revealed an 12% increase in family satisfaction and a 23% increase in patient satisfaction after implementing of the BSR process. The ultimate outcome of this change project was to improve patient safety, to improve patient satisfaction, and to improve communication between nurses during shift change and ultimately decrease patient errors due to miscommunication, and to improve nursing satisfaction. Process steps. So the first step in the process of implementing my change project is to present the plan to my unit nurse manager, charge nurse, and all unit staff. After getting approved to implement this change project, we will begin implementing bedside report on the unit 73400 at Strong Memorial Hospital for a 3-week trial from July 17th to August 6th. I will be responsible for providing staff and patients an anonymous survey where they can voice their thoughts at the beginning of implementation of bedside report week 1, the middle of the implementation week 2, and the end of the bedside report trial week 3. I will then present my findings to the unit manager as well as the charge nurse to see if bedside report is something we would like to continue doing on our unit. The expectations of my change project. I expect that bedside report will increase nursing communication during shift change and patient handoff. I expect that there will be less miscommunication with bedside report implemented. I expect that bedside report will increase patient safety. I expect that there will be an increase in patient satisfaction with bedside report. I feel that patients will feel less anxiety, and bedside report will help the nurse and patient build a more trusting relationship. I expect that nurses on the unit will have an increased satisfaction with bedside report since it will increase nurse-to-nurse communication, causing them to do more of their 60-second assessments, making sure that they are completely aware of what's going on with the patient before they take over care. The results of my change project. So there were some mixed feelings at the onset. Charge felt that it was more difficult to stay updated with patients on the floor. Originally, we had always done group report, so Charge was able to stay updated during group report at the beginning of the shift and throughout the shift. But the nurses on our unit generally found that they liked bedside report over our usual group report because they felt that the nurse-to-nurse communication was improved and they felt they were better prepared for their assignment since they were actually able to go and see the patient and do their full 60-second assessment and completely get the full picture of what was going on with their patient before they completely took over care. Patients on our unit said they enjoyed bedside report because it helped them feel less anxious since they were more involved in their handoff. One patient stated he felt the nurses had a better understanding of what was going on regarding their care. Like I said before, bedside report forced the nurses to do their 60-second assessments, which sometimes nurses get busy and they don't get to do that. With bedside report, nurses were forced to do it because they were in the room giving report and going over everything, going over the drips, making sure that everything was correct and set up correctly. Overall, both patients and nursing satisfaction was increased by bedside report on our unit. Evaluation of my change project. So there was a significant improvement in nurse-to-nurse communication compared to our old style of reporting. Nurses had a better understanding of what was going on with their patients by getting bedside report because they were actually doing their 60-second assessment before completely assuming care for this patient. They were making sure everything was set up correctly, such as drips. They were doing those checks that are so important and thus improving patient safety. Using bedside report more consistently and having a longer trial will ultimately show better results. And to improve this project, I feel I could further look into the statistical data of how bedside report impacted patient safety, including medication errors, patient falls, as well as other aspects of patient safety. That's something that I would definitely want to look into the future. I hope you enjoyed my change project, and I look forward to listening to all yours. Here are my references that I used from literature. And here is a full copy of my honor code like I included in the beginning of my PowerPoint.